Hello, everyone. I'm Dr. Michael Brand-Sawatsky. I oversee the Pickup Family Neurosciences Institute at Hoag, and today the topic is multiple sclerosis. I'm very privileged to have as our guest the head of our multiple sclerosis program, Dr. Yasir Jassam. Dr. Jassam is a subspecialized neurologist in the field of multiple sclerosis and neuroimmunology, with training at the National Institutes of Health in that area. Multiple sclerosis prevalence in the population has been increasing lately. Is that right?
Well, yeah. Multiple sclerosis has been a focus of interest now for many years, especially with the development of new therapies. But in terms of numbers, it's been on the upgo for a while. The last time we checked, there was about 1 million people in the United States diagnosed with multiple sclerosis, and the number before that, which wasn't that long ago, was only 400,000 people.
So speaking of that, how do we currently diagnose multiple sclerosis, and what are the advancements in more accurate diagnosis of multiple sclerosis?
Sure, well, that's a great question. There have been sets of criteria. Ways to diagnose MS have been based on judgments by the specialist most of the time. But in the 1980s, we had something called the Poser criteria, where people used. And since 2000, we had the Ian McDonald's criteria that we have updated over the years until the latest version that was just lastly updated 2020. And basically, we need to see evidence of the dissemination in time and space. That's what we call it.
Well, wait, let me stop you there. Dissemination of what in time and space?
So that's actually the point that most people get a little bit confused about. The name multiple sclerosis requires you to have multiple events affecting multiple parts of the nervous system. So dissemination in space means you have affected at least two totally separate regions of the nervous system.
So two different functions of the body are impacted.
So the most common example we give to people is that the vision will go off. Somebody will have a blurred vision, and maybe 2 months later, they have a numb leg. That's what we call dissemination, time, and space.
So it seems to me that that's an easy prescription for misdiagnosis. You have somebody's name attached to criteria. Well, the Brand-Sawatsky criteria may differ from the Smith criteria based on the images obtained with an MRI scanner.
Correct.
That shows lesions, but they may not be signature lesions of MS. They could be caused by other disorders. And so you add the subjective criteria the patient experiences and the physician puts together over time and space, and you come up with a pretty certain diagnosis, or not so much?
Well, actually, if you look at the criteria themselves, if you apply them strictly, which as you correctly said, there's a lot of people who get the diagnosis by mistake just because the criteria probably were not applied strictly.
It's more than just standardization. It's also multiple sclerosis specific standardization of the reporting structure that would provide value to you, yes?
That's actually the whole point, is that when the radiologist looks at the MRI, most of the radiologists will report the number of lesions, and maybe some of them will tell us if there's some increase in size or decrease in size, but that's as best we can get from the report. The new vision about that is to talk about the specificity of the MS lesions, as in the positioning, the number, and the actual increase in volume, and the association with expansion in certain structure will mean different things to me. If it happens, for example, in the spinal cord, it's more worrisome to me than if it happens in the cortex. And each of them will guide me down a different pathway. So in this software, the new way to look at the imaging techniques is not only going to tell me what's happening in the lesions, but it's going to give me specifically that these are MS lesions, and the changes happening likely reflects progression.
What's the future hope in your eyes of dealing with this disease?
in the future, we need to actually know more about MS activity than we know now so we can answer patients with a certainty. Most patients sit in our clinic and they say, what's the future holds for me? Am I going to get worse? When am I going to get my vision back? When am I going to get my walking back? We have multiple questions that have no answer. Is my medication working? With the help of Octave and the new technology and the new vision of MS, we hope that actually we can answer those questions with a lot greater deal of certainty, because with that, we will not be making guesses. We will be making some evidence-based answers. And that's hopefully is going to be the new vision, the new way in looking at MS.